Good morning, and thank you so much for joining us for this edition of SBB University. I am your host and moderator, Amanda Barton, also the publisher of Seniors Blue Book. Very delighted today to bring on this dynamic group of blondes. We will joke about that later. We first have Miss Chris Austin, who is an aging life care specialist with Cypress at Home. How are you this morning, Chris?
I'm well. Thank you for having me here.
Absolutely. So tell us a little bit about yourself and what led you into this beautiful role that you're in that's so special for our seniors out there.
All right. Do you want my personal story or do you want the story of Cypress at Home?
A little bit of both.
Okay. So I'm a social worker by background. My official title today is Program Manager for Choices by Cypress at Home, and we are aging life care professionals, aging life care managers, aging life care specialists. As a social worker, I've worked for many years in different senior living type environments. And my previous jobs were never incredibly fulfilling, I think, in the beginning of my career. One day I was in my office. I was a discharge planner in a rehab. This was in a different state. And I was doing my work. An adult daughter of one of our residents came into my office and said, Chris, my mom is discharging on Saturday, and you've been so helpful while she's been here. But what I really need you when she goes home. I would love it if you could come and visit her there and help us troubleshoot when she runs into trouble, or if, we have questions, we have a resource to go to. And if you would do that, I would pay you privately to do that. And it made me start to think, wow, that would be a great business, is to be able to do social work out in the community and serve people in their home and just charge them hourly for my services. There are just so many opportunities that it would be like the best job in the world. So I started doing some research, and sure enough, it's a thing.
Who knew?
There was an organization. They had a national website, and there were people there, aging life care managers all across North America, that were doing this type of work. It's sort of consultative, I guess, in a way. And so I got credentialed to do the work and have been doing it for at least 10 years now. When I moved to Florida, Lee Health, I realized, had a care management program. So just like the business that I had started in another state, it existed right here in Lee County. So I joined the Choices team there. And in October of 2019, when Cypress at Home was born, the Choices program from Lee Health moved over to Cypress at Home. And we continue to do what we've always done, which is support aging individuals in their home, wherever that might be, and help support them to age in place and live successfully and have the highest quality of life they can possibly have, despite their challenges of aging.
Yeah, and I always say you're the daughter that they never had, or the daughter that replaces the one that's out of state temporarily, that can speak that clinical language that's so important. All right, Chris, thank you so much. What a great introduction. All right, Miss Dina Calenzo with Mobile Physician Services. How are you this morning?
Hi, I'm great. Thank you. And thank you for having me. So I've been here in Southwest Florida for about 16 years. Always been in the service industry in some fashion, but not healthcare. And I did not get into healthcare until about 10 years ago. Always been, again, though, in the service industry in some facet. And I joined Lee Health about 10 years ago as a guest services manager at the rehab hospital downtown. I moved over to the post-acute world when we reorganized and went into marketing sales, as that's been my background for many, many years, and really understood the holistic view of the patient, being able to, unfortunately, go from, and what the gaps were from the patient going from the hospital to a post-acute service line, and kind of what those gaps were. And I help the case managers walk them through that process and help the patients get to the next step because they're very overwhelmed at that point. So having several years experience doing that, I went actually into an assisted living world, into the role of a marketing sales director there. And I got to see a whole different view when you're inside, right? And seeing what those residents look like, the challenges that the families have, especially, and understood now that world, even more of the post-acute world of coming from the residents' eyes. And understanding that, that's where I met mobile physicians, and I met them during COVID. So that was also another challenging time, and really fell in love with mobile physicians, being, you know, with the hospital in the clinical world for many years, and then meeting mobile physicians. They had a position open for me that kind of just married that all together. And what I do very well is taking, you know, doing that patient care and doing sales and marketing and marrying that together. So we are a house calls group. Dr. Waxman started this group 15 years ago in Newport Richey. I cover Southwest Florida. I'm able to speak with patients inside their homes, perspectives. Then we go into homes and we go into ALFs, independent livings, to keep them more independent. We go into assisted livings and we go into memory care. So that's kind of what I do for them. And it was just a perfect kind of transition for me. So it's been a great journey.
Awesome. Thank you, Dina. All right. Last but certainly not least, we have Miss Carley, who's joining us from Advocate in-Home Care. How are you this morning, Carley?
I'm great. Thank you for asking, Amanda, and having us on today. My name is Carley. I'm with Advocate in-Home Care, and I got into senior care. I come from a clinical background. I studied medicine in undergrad and ended up getting right into skilled care back in 2012, and then kind of slowly took more of a marketing sales role back in about 2013. I transitioned to work with Advocate when I moved back from Indiana. And I've worked with Advocate now for 3 years. Everything's going great. I love the company so much. And Advocate is a nurse registry. We are one of the largest registries here in Collier County. And we provide in-home care for seniors, again, wherever their home setting may be. And we try to help them maintain their independence for as long as possible.
Absolutely. So this dynamic group of ladies is, today we're going to be covering the topic of aging in place. These are resources to keep you safe and independent in your home. So we're going to start with a couple rounds of questions. Chris, just tell me exactly what an aging life care specialist does. You've explained, you know, your thought process and what the daughter asked you to do. And I love hearing those personal stories, but tell me exactly what a day looks like for someone in the field.
No day is ever the same. And no, and no matter how well we try to plan, it's unpredictable. You never know because life happens. So, but sometimes, like you were saying, some people call us the Florida daughters because we do very much what an adult child would do for their parent. Only we all have industry expertise and some type of educational background that supports the aging industry. We usually start our work with clients with an initial comprehensive assessment. So that's us going out into the client's home, wherever it might be, whatever setting that might be, and really getting to know them well. We go through their medications, their medical history, but we do so much more than that. We talk about their legal and financial preparedness for aging. We ask them about their wishes for end of life and make sure that their advanced directives reflect what their wishes would be. We look at their nutritional status, their functional status, their cognitive status, their emotional status. So after gaining a very good picture of, you know, how that client functions and what their needs are, we will create a plan of care for them, which identifies risks for them, and then accommodations to the home or other types of resources or supports that will help for them to be successful in their environment. So after that, we will address, the concerns that may come up during a care plan. And that could be anything from them needing help getting to and from doctor's appointments, and not just the transportation. We actually go in the examination room with the client. We ask questions, we take notes. Very often we're relaying that information then back to the family members who live out of state or out of town, or to other providers too, to make sure that if there's a change in medication or a treatment that's prescribed, that there's follow through with that. If someone if home is not appropriate any longer and someone needs to consider placement options, we will help to make that happen. Some people have asked us for referrals to realtors and to help get their home ready for a sale, or to help with the move. So some people need help in the home to stay in the home and be successful. Sure. They may need a home care agency. They may need home health. They might need adult day. So we have, one of our care managers calls it a Mary Poppins bag of tricks that we keep with us. And so we are very often our providers' best friends, because we are constantly connecting our clients with the resources that they need to be healthy and well in their home environment. So it's any and all tasks related to that.
Perfect. Perfect. And I want to loop back around and ask you a couple more questions, but Dina, if we could bounce to you, tell me a little bit about the services that are under the umbrella of a mobile physician, like mobile physician services.
Sure, we're a little different. I like to say we stand out. We do things a little bit different at mobile physician services, because under mobile physician services, we do go into the home or into the senior community and take over as your primary care. That is one prerequisite. And when we go into the service lines, we have under us podiatry, psych, pain management, and we take over as primary care. So we say the 4 Ps. So we have all of that under us, under mobile physicians. You can still go out to your specialist, your cardiologist, your endocrinologist, but we take over as your primary care, number 1, and then we offer those other 3 service lines as well with mobile physicians.
Now, do you take insurances, or how does someone enroll for your services?
We do. We take Medicare, Medicaid. We are in the middle of contracting with the 5 big Advantage plans, United Healthcare, Cigna, Aetna, forgetting to Humana, all PPOs. And Blue Cross Blue Shield right now. We're just concluding that as well. We do have a couple private paid. And sometimes I still say to them, let me run your insurance, because sometimes the out-of-network copay and the in-network copay are exactly the same anyways. We won't take HMOs. We'll never take HMOs, unfortunately. But yes, absolutely, we take all of those insurances.
Perfect. All right, Carley, tell me the difference. There's such a misconception when people talk about home care versus home health and what's covered. So talk to me about private pay versus a Medicare certified home health care company.
Yeah, great question, Amanda. This comes up all the time in the community. Medicare home health is a skilled service that's covered under your Medicare insurance. Typically, it's referred to as home health. And that is a skilled nurse, physical therapy, occupational therapy, speech therapy, so any of your therapy related services. Private in-home care is often referred to as private care or private duty or home care, and we are private pay. We are in network with long-term care insurance. So your long-term care, if you have a separately purchased policy, this is separate from your Medicare and your supplemental. And it is called long-term care insurance, and their policies do help reimburse for private in-home services. We have long-term care specialists. I'm a liaison that would come into the home, meet with you and your family. We can discuss care options, your needs, and I can help you navigate your long-term care policy and your financial information.
Perfect. And once somebody signs up with you guys, you do a care plan. Tell me what a care plan is and how it helps keep everyone's expectations in line.
Definitely. So like I mentioned, I am a client care liaison. So kind of how we go about meeting with our clients, they reach out to us for a need, which is typically some type of assistance in the home environment to maintain their independence in that level of care that they need. So that could be anywhere from transportation, bathing assistance, medication reminders, meal preparation. And if that is something that the family is looking for, then I, as a liaison, would go into the home for a complimentary in-home assessment, meet with the family, talk with them in detail about what exact level of care is needed. And then that way I can make sure that I pair the right type of clinician to meet those needs. We offer certified nursing assistants, home health aides, licensed practical nurses, and registered nurses. So depending on the level of care that one might need, we would match them with the appropriate clinician, and we would determine the type of schedule that's going to best fit their needs, exactly what services, as we mentioned, that they are needing and would be best for them.
Perfect. Thank you. All right, Chris, now you mentioned you came from the world of Lee Health. And I love the description when you were explaining to me what Cypress at Home was, that Cypress Cove and Lee Health got together and they had a baby. There are so many advantages to what you guys provide because of that affiliation with Lee Health. Talk to me about why that affiliation is important, giving you access to records and things of that nature.
Yeah. One of the biggest advantages I feel like in being affiliated with Lee Health is we do have access to Epic, which is the electronic medical record platform that all of Lee Health uses. So for our clients, our care management clients, if someone interfaces with a Lee Health provider, whether it's one of the hospitals, the emergency departments, the memory clinic, a physician's office, an outpatient center, home health, if they have records or have interfaced with any of those providers, we have access to seeing the notes and seeing the documentation for that. That can be hugely helpful when, say, on a Sunday afternoon, I get a call from a family member whose parent lives here and mom has gone into the emergency department. This actually happened to me. And so mom's in the emergency department at Lee Memorial Hospital and the family doesn't know what's going on. I can write from the convenience of my own home, open up my laptop, log into Epic, check the notes and see what's happening real time. So that can be invaluable information that we get and then can relay to family members.
Yeah, and what's amazing about that is if the family member were sitting there themselves and the doctor came in to talk to them, they're in panic mode and they don't speak clinical, so it's good that you can break it down in layman's terms and be that, clinical advocate for them. So when should someone consider looking at a service like yours? When would you say is the time to start interviewing like an aging life care specialist company?
I think a lot of our clients come to us after a pivotal life-changing event. So maybe it's a fall where an injury has occurred, or a hospitalization or repeated hospitalizations. We call it the revolving door in this industry, right? Hospital, rehab, home, hospital, rehab, home. So if that's happening and we need to stop that cycle, that's a great time to get a care manager involved. We don't like to wait till a crisis, but sometimes when that happens and you don't know, you want to carefully review your options, not make any decisions without being informed about it. That's a great time to get a care manager involved because we can jump in and help sort through all of that and help navigate through those complexities.
Sure, definitely. Waiting for a crisis may not be the best time, right? You want to know what your options are ahead of time for sure.
Yeah, a lot of our clients, probably most of them, are suffering from memory loss. And that's why their independence is at risk. So that also is a good time, a new diagnosis of memory loss, or maybe when memory loss is starting to get in the way of them being able to be successful at home. That would be a good time to get a care manager involved so we can place interventions right away to keep someone safe.
Sure. Yeah, definitely. All right, Dina, talk to me a little bit about the way that people, well, you talked about payment. What are some of the services that would keep someone independent in their home that you guys provide? How do you keep them independent?
Exactly. I did want to add on that. So when we come into the home, I get a phone call. Usually it starts with me that's in their home and saying, I actually got one yesterday, so I can use a true story. This lady has had a hard time finding a primary care. She just moved here from New York. She has to wait months. She needs to see a specialist. She can't get into the specialist until she sees her medical records. It kind of helps that I have that clinical background too, have some references. Our doctors and nurse practitioners also have some references for some specialists that we work hand in hand. I just wanted to point out, we are on our own EMR system as well and eClinical work. So our providers, all those 4 Ps I talked to you about, primary care, podiatry, psych, and pain management, they all talk to each other. So we can all see. We're not on Epic, but when a patient does go into the hospital, we are able to follow them. We don't go in the hospital, but they're very well aware to fax us their records after. So when we know they're getting out of the hospital, we can make sure that we have a visit to either that community or in-home within the first 1 to 3 days, so we don't miss anything and there's not a gap there. So I just wanted to point that out. Mm-hmm. So anyways, back to my story. So she's like, I can't find a specialist. I said, well, let me help you. I could take over as your primary care. That's rule number 1. I have to be able to take over as your primary care. When we go into a home, you do have to qualify as homebound. Mm-hmm. She is using a walker now. She's having trouble ambulating. So that qualifies her as homebound. She needs some physical therapy. Again, a lot of connections with a lot of home health agencies around. So like I'm looking at us right here, we kind of fit as a puzzle. If she needed a care manager, I could help her get advanced directives. I could help her get some private duty in the home. If she needs help with cooking, light housekeeping, maybe help getting back and forth to the bathroom or bathing with advocates. So we kind of fit well together. And I kind of help during that first conversation, put all those pieces together to help that patient understand exactly what they might need besides just a primary care physician. They may need more than that. Sure. So I do go through with them. Do you have a power of attorney in place? Do you have your advanced directives in place? Do you have your DNR in place? Do you need any help in the home? Do you need a care manager? Are your children in state or out of state, et cetera, et cetera? So I go through all of that with them. And she said to me, wow, I've never even heard of a mobile physician. And I'm like, what? But I kind of like the milkman days. I said, everything that goes around comes back around. They said, we won't deliver your milk, but we will deliver your physician to you. So that's kind of what we do. Once they fill out our paperwork, I either email it to them or can send them a DocuSign. They send me their insurance, or it goes to our intake team. Our scheduler calls them up. We see them between 2 to 6 days, as long as it's not an emergency and they don't have a wound and something urgent. And they have to have a first visit with our primary care. From there, we send in who we need to send in. If psych needs to be sent in next, if podiatry needs to come in, if pain management needs to come in. And then if they also need help with private duty, I reach out to my counterparts out in the field here in Southwest Florida, Collier, Lee, Charlotte, and and upward through the state, and help with all of that, putting it together so that we understand that patient now is getting taken care of holistically.
So in other words, Dina always has her seniors blue book right next to her.
I do. I cannot live without it.
And speaking of delivering the milk, that's where Carley comes in. Carley's company will deliver the milk, right, Carley?
That's right.
Exactly. Exactly.
Yeah. Now, people are concerned about folks coming into their home. So tell me a little bit about the background checks and screening process that's done with companies like yours.
Yeah, so all the caregivers that are registered with us have to go through an FBI level 2 background screen. They have to also have their fingerprints done. And our registration team is wonderful. And so they make sure and they work with the caregivers to make sure that they have all the proper documentation completed before they onboard. They also have to go see their physician for a physical. They have to provide all their continuing education hours annually for their CNA or HHA license. And so we're very in touch, and we make sure that all of their documentation is up to date and in compliance with ACA through the state of Florida.
Now, I've asked a couple questions of these ladies as well. When would be a good time to consider chatting with you about home care? Because you don't really want to wait for an emergency. And then what are some of the ways that someone would pay? I know we talked about long-term care insurance and private pay, but is there any other like veterans benefits or anything like that?
Yeah, great question. So we'll start kind of from the beginning. You definitely don't want to wait until there's an emergency. I know pre-planning and planning ahead is always, if available, always the best option. So the best time to kind of start reaching out to a company like myself, like Advocate, would be if you find that you as a family member are starting to feel burnt out, that you're providing a lot of assistance and your loved one is starting to need more and more day-to-day help. Even if that's as simple as scheduling doctor's appointments or keeping them organized and together, making meals for themselves. If they're forgetting to eat and you're having to bring over food and cook for them. And, it can be taxing on a lot of family members. They work full time. So if you're in a position where you're starting to feel like you yourself as a caregiver or a loved one could use some additional support, it's always great to reach out, and we can start to work with you and talk with you about options and ways that we can get started and introduce the caregiver. I know that it can be a big adjustment for somebody to have somebody new coming into the home. So we like to, as I mentioned, do the in-home, complimentary in-home assessment, where we go in and we meet the family. I speak with them, answer questions and concerns that their loved one might have regarding having somebody new come in. I can always have the caregiver come out and meet them as well, so that they get to know who's going to be working with them and in their home. And really, it's when you start to identify falls is another key factor to identify. If your loved one is very unsteady or at risk for falling and may need some supervision, transportation, if they can no longer drive, it might be hard to navigate the transportation piece, getting to the grocery store, picking up prescriptions, just simple day-to-day tasks. Personal hygiene is another key indicator that it might be time to get some support in the home. You may notice that your loved one is forgetting to shower or wash their clothes as frequently as they used to. And that's where a caregiver can come in and really support them with that. As far as the cost option goes, so there's 3 ways that you can pay for private in-home care. As we mentioned, long-term care insurance is one. That's a great option if your loved one has a long-term care plan that they've paid premiums on. There is VA support, so the aid and attendance benefit. They do reimburse for in-home services such as ours. If you
qualify, yeah.
If you qualify, yep. So there's some qualification factors that go into that. I can help you navigate that or direct you to a resource that can help you with the application process. And then private pay. So us personally, we are a non-binding contract, which means you're not required to use us for a set length of time, but we do bill on a weekly basis. We do take a security deposit up front for 1 week of care that's fully refundable. That way, there's some cushion there. If you need to make some changes to your schedules or adjustments, we can work with you on that as well.
Perfect. Thank you. Well, ladies, this has been extremely informative, and I want to thank you for your time. Do you have any closing remarks before we wrap things up? Because we did that good.
We did that good.
All right. Well,
I just wanted to kind of shout out our website is www.mobilephysicianservices.com too. If you wanted to check us out, look us up. We have all of our service lines, our history, our providers on our website. So kind of want to put that out there.
Perfect. All right, ladies. Well, thank you so much. We will definitely put your contact information in the chat box. And if you have any questions for these ladies, don't hesitate to reach out. And thank you for watching this edition of SBB University. Have a good day.